Hey guys, Tony here. In this video, I want to show you some source documentation that you could start using to answer your questions and kind of develop your policies. Because at the end of the day, if you don't have references to back up your decisions are going to be held to, who knows what standard. So the biggest challenge for a therapist in private practice, PTOTSOP, is finding the reference documents that you need. I'm going to show you kind of a little trick that I use. So the first thing I do is I know that an LCD, a local coverage determination, is a document Medicare publishes to help us get information. So CGS is my local MAC. I'm here in Ohio, and physical therapy is my discipline. So what I did was I typed in CGS LCD physical therapy. I hit search. First search result took me here, which really didn't give me the documents I was looking for. This is for home health and hospice. That's not what I needed. So then I clicked on the next one. That took me out here, which gave me a whole bunch of documents. Still not what I needed. So then finally I got to outpatient physical therapy, and I came up with this LCD L34049. This is the information that I'm looking for. Now, I'm in Ohio, so I came down to Ohio Part B. When I clicked on this link, guess what? It doesn't work. So then what I did was I said, okay, I know the source document ID. So I went back to CMS. I typed in under document ID, did a search for that specific ID, and that took me to this page here. And so this is what I was looking for. This is, this was last updated 11/2019. And having seen these documents for decades, I know this is what I'm looking for. So then what I did was, because I can't really save this, I clicked on need a PDF, and that kicked it out into this document. And so now I've got my PDF that I can save and modify and highlight and do anything I want to. And this is what we're going to talk about in this video. And so let's specifically talk about therapeutic exercise as it relates to a hybrid practice model. So obviously, these are the guidelines published by CGS, my MAC. Therapeutic exercise used for the purpose of restoring or maintaining strength, endurance, range of motion, flexibility, where loss or restriction is a result of a specific disease or injury that has a result in a functional limitation. These are important words. These are words that I could tell you I would be using in your documentation, on the eval, the plan of care, anywhere that you're justifying medical necessity. Therapeutic exercises may require active assist, passive participation by the patient. Many exercises may require the unique skills of a therapist to evaluate the patient's ability, design the program, instruct the patient or caregiver. So evaluate, instruct, design. These are important words. These are words that I want to see in documentation. Right? Instruct the patient or caregiver in a specific completion of the technique. However, after teaching has successfully been completed, repetitions of the exercise and monitoring for completion of the task in the absence of additional skilled care is not covered. Now, this is where we start to make the transition, right? However, I'm going to go with that because that's an important word. And they give us an example, and this is what I want to share. This is the kind of stuff for those of you interested in joining the next live cohort for Zero to Paid, the Medicare billing course. Like, we go through the mechanics of creating a claim for Medicare, right? We discuss all of that. But I think practical application and looking at source documents is really where the value comes in. So here's a classic example. I've shared this multiple times, but it's worth sharing again. As part of an initial therapy program following a total knee replacement. If you guys don't know it yet, I kind of focus my whole practice on being the expert provider in total knee replacement. A patient may start a session on an exercise bike to begin gentle range of motion. No problem. Initially, the patient requires skilled progression, performing pedal rocks, building to a full revolution, perhaps assessing and varying seat height and resistance along the way. I think we all agree with that. Once the patient is able to safely exercise on the bike, no longer requiring frequent assessment and progression, even if the setup is still required, the bike now becomes independent. It's no longer covered by Medicare. So what does something like this look like in practical terms in the clinic? Guys, if you want to go over this and for me to share the what this looks like in a real world situation, consider joining my Zero to Paid group, consider taking the course. These are the things that you just can't get from source documents like that. Anyway, I'm going to try and do a live video every day this week. The course starts October 6th. I'll catch you then. Thanks for watching, guys.